Good morning, I am Dr. Seema and today we learn about the blood vessels and nerves of soul. Specific learning objectives of today's class. At the end of the class, students should be able to explain the origin, course, branches and applied aspects of plantar nerves and vessels. And the second objective is students should be able to explain the plantar arch in brief. Plantar vessels and nerves enter the soul deep to flexor retinaculum along with the long flexor tendons of the toe, and the interval between the flexor retinaculum and the calcaneus forms the main gate of the soul, and hence it is called as the porta pedis. The main arteries of the soul are medial and lateral plantar arteries, which are the terminal branches of posterior tibial artery. The main nerves of soul are medial and lateral plantar nerve, which are branches of tibial nerve. Plantar vessels and nerves are formed deep to flexor retinaculum, and the plantar vessels include medial and lateral plantar arteries, which are branches of posterior tibial artery, and the plantar nerves includes medial and lateral plantar nerves, which are branches of tibial nerve. Medial plantar artery. It is the smaller terminal branch of posterior tibial artery. It appears in the sole deep to abductor hallucis. It is accompanied by the trunk of medial plantar nerve on its lateral side. This artery, when it reaches between the abductor hallucis and flexor digitorum brevis, it becomes superficial and it divides into further branches. Branches of medial plantar artery. Medial plantar artery gives off cutaneous, muscular and digital arteries. The cutaneous supply is to the medial aspect of the soul, and muscular supply is given to the adjoining muscles. Digital arteries, it gives off a digital artery to the medial side of the great toe, and it gives three superficial digital branches that ends by joining first, second and third plantar metatarsal arteries of the plantar arch. Lateral plantar artery. It is the larger terminal branch of the posterior tibial artery. It runs forwards and laterally between the muscles of first and second layers of sole. At the base of fifth metatarsal bone, it gives off superficial branch and continues medially as plantar arch between the third and fourth layers of sole. It terminates by joining with the dorsalis pedis artery in the first intermetatarsal space, and this artery is accompanied by lateral plantar nerve on its medial side. Branches of lateral plantar artery. It gives off cutaneous branch to supply the lateral aspect of the sole, and muscular branches to supply the adjoining muscles. It gives off anastomotic branches to anastomose with the branches of dorsum of foot. Then it gives off a calcaneal branch to supply the skin of heel, and lastly it gives two terminal branches that are superficial and deep. The superficial branch will be supplying the lateral aspect of the little toe, and the deep branch will be forming the plantar arch. Plantar arch. It is formed by the direct continuation of the lateral plantar artery or deep branch of lateral plantar artery, and it is completed medially by the dorsalis pedis artery in the first intermetatarsal space. So the extent of plantar arch is from base of the fifth metatarsal to the proximal part of the first metatarsal space, and its convexity is directed distally, and this arch lies between the third and fourth layers of sole, and it is accompanied by the deep branch of lateral plantar nerve. Branches of plantar arch. The plantar arch gives off three proximal perforating arteries which communicate with dorsal metatarsal arteries by passing through the gap between the heads of second, third and fourth dorsal interossei. The arch even gives off four plantar metatarsal arteries which pass straight forward in the intermetatarsal space and will be divided into plantar digital arteries to supply the adjacent sides of the toes. At the metatarsal head, each plantar metatarsal arteries will be giving off distal perforating arteries which will be anastomosing with the similar arteries of the dorsal metatarsal arteries. Along with the proximal and distal perforating arteries, corresponding perforating veins pass and drain the venous blood from the sole to the dorsal venous arch. Medial plantar nerve. It is a larger terminal branch of the tibial nerve and it is accompanied by medial plantar artery on its medial side, and it appears in the sole beneath the abductor hallucis. The trunk of the nerve passes forward between the abductor hallucis and flexor digitorum brevis and appears in the interval between them. Here it divides into different digital branches and ends its course. Branches and area of distribution of medial plantar nerve. The medial plantar nerve supplies four muscles: abductor hallucis, flexor digitorum brevis, flexor hallucis brevis and first lumbrical. And the cutaneous supply, if you see, it supplies the skin of the medial part of the sole including medial 3.5 digit. The cutaneous branches reach the skin by piercing the plantar aponeurosis. The large cutaneous distribution accounts for the larger size of the medial plantar nerve. It gives articular branches to tarsometatarsal, metatarsophalangeal and interphalangeal joints, and it gives off dorsal branches to supply the region of the nail bed. Lateral plantar nerve. It is a smaller terminal branch of tibial nerve and appears in the sole deep to abductor hallucis, and it is accompanied by the lateral plantar artery on its lateral side. The trunk of the nerve passes forward and laterally to the base of the fifth metatarsal bone in between the first and second layers of muscles. On reaching the interval between the flexor digitorum brevis and abductor digiti minimi, the trunk divides into superficial and deep branch. Branches of lateral plantar nerve and its area of distribution. It gives off muscular branches to 14 muscles of the sole, and they are flexor digitorum accessorius, abductor digiti minimi, flexor digiti minimi brevis, all the interossei, that means 3 plantar and 4 dorsal, and second to fourth lumbricals, and transverse and oblique head of adductor hallucis. And the cutaneous distribution of lateral plantar nerve, it supply the lateral margin of the sole and lateral 1.5 of the digit. Dorsal branches of the plantar digital nerve even supply the region of the nail bed. Then it gives off articular branches to supply the intertarsal, tarsometatarsal, metatarsophalangeal and interphalangeal joints. Babinski's reflex or plantar reflex. When you stroke the lateral aspect of the sole from the heel to the ball of the foot, curving medially across the ball, there will be a movement of the toes, normally as plantar flexion, and this is called as the normal plantar reflex or negative Babinski. In case of Babinski's sign positive or reflex positive, the toes will be dorsiflexed. Morton's neuroma. A neuroma is a growth of nerve tissue. A neuroma may be formed on the branch of medial plantar nerve between third and fourth metatarsal bone, and this neuroma is termed as Morton's neuroma. This causes pain between third and fourth metatarsals usually results from wearing tight shoes and repeated irritation of the nerve. Thank you and have a nice day.